Hi, Dr. Kim with Chiropractic. We have Joe here who has been a patient for a little bit, and he came in with some very painful shoulders with restrictions in his range of motion. And when you first came in, Joe, you had, if you remember, like very limited range of motion.
Yeah, I can barely get it straight out.
Yeah, so he was, when I measured, it was basically a little bit about 90 at flexion. And then less than 90, it was what we call a frozen shoulder. And so what we did is we used, we have a new machine by Chattanooga, it's a radial pulse wave. And what that radial pulse wave is, it's a form of like shock wave that allows to help patients with chronic inflammation, chronic pain, muscles, tendons, ligaments to start healing, to bring blood flow to the area. It helps to break up some adhesions and create better range of motion, and obviously healing and expedite that process. And so better than ultrasound, better than even deep tissue trigger massage therapy. And so, and how are you doing today there?
Pretty good. After 2 visits, now I can raise my arm above my head.
Yeah.
And that's amazing. And I can get
There too, yeah.
to that way.
And prior to even getting this therapy, you were scheduled and planning to schedule to get what?
Injection.
Yeah, he was planning to get a cortisone injection, and
painful.
super painful. So this is a natural way to get our patients better. Really helps with not just shoulders, but elbows, knees, ankles, plantar fasciitis, neck, lower back issues. And so if you guys have any of those issues, we'd love to help. Feel free to call us at the office, 623-334-4114. Thank you. Ready? And go ahead and raise your arm. And down. Reach behind. Reach behind the back. Back forward, and then to the side, there we go, and relax, and slowly above your head to the side, there we go, and down.
All right, Joe, so tell us what it was like before your treatment, like what was your limitation?
My limitations was I could barely get my arm like this, have
Okay.
excruciating pain.
And then after your treatment, show us what you can do now.
Well, by this first one, I was like that. And then by the second, I was able to like that. And then now this is the third one. I
Wow.
can get my arm all the way up.
Wow,
So,
big difference. Big difference. Okay, and what did you notice like after your first treatment? How did you think? What did you feel?
that it was something was happening.
Okay.
Something was happening to make it better. So
Great.
compared to the injection that they shoved that needle in my arm, but
What kind of injections were you having before?
I don't know, some sort of steroid or something.
Okay, okay. And how many treatments have you had so far?
This is the third one.
Okay, great. Well, I'm glad you're seeing results. Dr. Kim is doing wondrous work with this new machine that we have called radio pulse wave treatment. Yeah,
Shockwave.
shockwave. Basically, it's a form of shockwave. So yeah, awesome.
But now when I came in today, I said I trying to reach across my shoulder and move my arm. I couldn't.
Wow.
So now I can go like this.
Oh, wow.
Lift my arm.
Nice.
That's pretty cool.
Great.
To be able to do that.
Great. Well, thank you so much.
Yep.